78 1/8 sulfa to allergic PT is sulfamethazoline. T12 is short and 90% is protein bond. 782 promethazine is a potent antiemetic. 783 hydroxyzine has the greatest antihistaminic action of the anxiolytic agents. 784 northisterone is used in endometriosis, but megestrol and medroxyprogesterone are better. 785 bromocriptine treats hyperprolactinemia as it is. Selective D2 agonist. 786 cabergoline, dopamine agonist, in Parkinsonism. Relieves symptoms, shaking, stiffness and loss of muscle control. 780 Savinian exchange resin as N-cellulose phosphate. Kidney stones or hypercalciuria. 788 cation exchange resin polystyrene sulfonate. Hyperkalemia. 789 anion exchange resin as bile sequestrants. Hyperlipidemia. 790 ion exchange used to separate charged substance. 791 cholestyramine is used as anionic exchange resin, bile acid binder. In hyperlipidemia, 792 carbachol is cholinergic agonist drug. Probucol is anti-hyperlipidemic drug. 793 phenoxylate opiate action in git treat. Diarrhea. 794 phenoxylate is given for acute uncomplicated diarrhea. 795 Lamotil don't cause atropine likelihood of abuse of the opiate. 796 phenoxylate similar to which drug? Pethidine. Imeridine. 797 which of the drugs belongs to meperidine? Pethidine. In structure. Diphenoxylate. 798 use atropine and diphenoxylate. Atropine. Abuse and addiction. 790 ranitidine is preferred over cimetidine because cimetidine is hepatic microsomal inhibitor and there are many drugs interact with cimetidine. 800 L-propoxyphene is antitussive. D-propoxyphene has 12 analgesic activity of codeine, not anti-inflammatory. 81 Treptokinase treats pulmonary emboli. 802 xanthanes such as theophylline and caffeine do all, except peripheral vasoconstriction. 803 bradykinin causes relaxation of smooth muscle and dry cough. 804 oral prednisolone or corticosteroids is not given to PT 11 years old with chronic asthma. He can give inhaled prednisolone, long-acting theophylline. 805 lupus erythematosus highest incidence in women. Doxepin has the greatest degree of antihistaminic action. 807 hydrophonium is used in diagnosis of myasthenia gravis. 808 the diagnostic element in blood for AIDS PT is detecting AB to HIV ELISA assay. 809 chondrocyte in osteoarthritis. Tophi in gout. Pannus in Ra. 810 pannus, or soft tissue nodules in Ra. 811 inflammation of synovial fluid and membrane. Synovitis, found in RA or arthritis. 812 NO initiated with inflammation in synovial membrane or fluid, SLA or OA. 813 in change, breakdown, in cartilage. OA. It is degenerative joint disease. 814 cartilage properties include convert to bone by ossification. 815 cartilage covers and protects bone from friction during normal joint activity. 816 inflammation in joints, arthritis. 817 persons susceptible to atherosclerosis. Which of the Following is unlikely to be dangerous. Ra. 818 Ra is more common in women than men. 819 not biological for Ra. NSAIDs and cortisone. 820 connective tissue that connects bone to bone is ligament. 821 typhus fever is caused by characteristic of rickettsia, epidemic typhus, murine, endemic typhus, and scrub typhus. Rocky Mountain spotted fever is caused by rickettsia. 822 The purpose of combined TTT and TB is to prevent proliferation of drug-resistant. 823 Filizumab, plaque psoriasis. 824 pyrogens are bacterial byproducts causing febrile reaction. 825 Which of the following actions is common? Clofebrate, nicotinic acid, cholestyramine, N-dextrothyroxine, and probucol. Antilipidemic. 826 Which does not affect heart, not associated with cardiac toxicity. Valproic acid. 827 Not symptom, characteristic of CHF, chest pain. 828 Mifloquine not cause hyperglycemia. 820 Nisotretinoin triglyceride and hyperglycemia. It causes new onset of diabetes. 830 Least likely to exacerbate seizure, cigarette. Smoking. 831 Least likely to happen with isotretinoin or retinoic derivatives. Constipation. 832 No symptom of serotonin syndrome. Constipation. 833 Which drug does not cause headache with overuse? Ergot. 834 Which is not C of chlorpromazine? Hypertension, vomiting, and hyperprolactinemia. 835 No say of nitrates, breathlessness. 836 Dapagliflozin not cause cough. 837 Not say of thyroxine or fluoxetine, WT. Gain. 838 Incorrect. Antifactor XA is used for measuring apixaban. 839 Which is not correct about vasopressin? Action. Enhanced by alcohol. 840 Diphenoxylate, atropine, lomotil, nadolol, and furosemide are least to not cause bronchospasm. 841 Metformin is not causing hypoglycemia. 840 Twau Hitch is wrong about alendronate, not cause hypoglycemia. 843 Tachycardia, tremor, and increment in AV node. Conduction are uncommon effect which is unlikely to occur with beta blockers. 844 Nicotinic blocker least likely to cause in salivation. 840 5-organophosphorus poison, which is not true. Xerostomia and tachycardia. Prednisolone least cause drowsiness. Prednisone, what is not C, drowsiness, and leukopenia. 840 Aprednisolone does not cause Ra remission, induce remission. Gold, induce and maintain. MTX, least one maintains remission is prednisolone. 840 Naninose of nifedipine, drowsiness. 850 Nifedipine is not used in GERD. 851 Milk allergy is due to protein. 852 Anticonvulsant needs eye examination, Thigabatrin. 853 Adrenaline autoinjector give an instant message in Snapchat for anaphylaxis 0.3 milliliters by one shot, while atropine is given only instant message. Wrong answer for adrenaline Q. Snapchat full dose. 854 NSAIDs not used with cytotoxic, MTX. 855 Amiodarone, if PT has fever, call emergency. 856 What happen if protein in blood? Edema. 857 Benzodiazepine toxicity in blood. Flumazenil. 858 chiral molecule, asymmetric carbon center. 859 yet at least 2 chiral carbons, diastereomers, ephedrine. 860 can contain 1 chiral carbon, enantiomers. Epinephrine. 861 enantiomers, optical isomers or isomers, same, molecular weight or formula. 862 diastereomers are cis and trans. 863 isomers have identical physical and chemical properties except for rotation of plane polarized light, while racemic mixture, like tartaric acid, has different physical and chemical properties. 864 enantiomers, not same as diastereomers. Or at least appropriate, they have the same MWT. 865 enantiomers are mirror image, not superimposed. 866 compound with 4 asymmetric carbons, isomers, 2216. 867 racemic mixture resolution, to separate, enantiomers. 868 racemic mixture, optically inactive, which contains equal amount of D and L stereoisomers. 869 needed for optical activity, asymmetric center. 807 meso compound contains internal mirror image, which gives superimposable image upon rotation. Optically inactive consists of even no. 2, 4. 871 seconds isomer, mirror image to R isomer of the corresponding compound. 870 12 dextro or R means rotate polarized light to right. 873 isomer of adrenaline is 20 times more active than D. 874 trans, GPS on both sides isomer of diethylstilbestrol is more active than cis. Why? Drug fits to the receptors well. 875 levardaranol is L-Ni. 876 atropine, D-L-hyoscyamine mixture, is more active than D-hyoscyamine. L-isomer is 100x more potent than D-isomer. 877 warfarin can be used in different therapeutic forms. It has optical active form. 878 conformation organic molecule determined by nuclear magnetic resonance NMR. 879 conformational isomerism is described as identical spatial arrangement of atoms resulting from rotation one or more single bonds. 880 chiral conformation of cyclohexane. Is equatorial. 881 the structure to be chiral. Rotate 90 degrees on the plane polarized light. The conformers could be known by physical properties, has a plane of symmetry. 882 prednisolone is more active than hydrocortisone, as it differs in the conformation at ring A. 883 dronabinol, which is true isomer of tetrahydrocannabinol THC. Another name is deltanine THC. 884 cis means two groups on the same side. Oleic acid is cis form means two group of atoms around double bond on same side. 885 ortho position is 1, 2 positions on benzene. Meta 13 and para 1, 4. 886 lactic acid, optically active by oxidation to pyruvic acid, inactive, which in turns reduced to lactic acid and reversible RXN. Lactic acid is 2-hydroxypropanoic acid, levofloxacin, ephedrine, and carvedilol are optically active. 880 quinine is optical isomer of quinidine. 889 ion drug with two polymorphs will differ in melting point, solubility, dissolution rate, density and stability, except pH and weight. 890 class of roxithromycin, macrolides. 891 filgrastim, granulocyte colony stimulating factor. GCSF and gelatin are protein. 89 2-methicone classified as silicon. It is antacid and antifoaming. 893 propylthioaryl methimazole carbimazole, essential GPA, thionamide, thiocarbamide. 894 guabenzin acetate is aminoguanidine derivative. 895 chimopapan used for therapy lower back desk. It's proteolytic enzyme. 896 antipsychotic drug loxapine is a neuroleptic of dibenzoxapine. 897 have good antibacterial activity sulfonamide. Convert in body to non-substituted aromatic amino group. 898 Fansidar antimalaria. Sulfadoxine blocks an early stage of biosynthesis of folate cofactors in the infecting parasite, while pyrimethamine blocks a later stage. 899 Membendazole MOA inhibit energy production, or inhibits the production of microtubules and blocks polymerization of tubulin dimers in the intestinal cell of parasite. 900 Hydrogel wound dressing MOA can absorb and retain the wound exudates, promote fibroblast proliferation. 91 Sulfonamide MOA block folic acid synthesis. It is bacteriostatic. 902 MOA of trimethoprim inhibits dihydrofolate reductase folate synthesis by competing with paminobenzoic acid PABA. It is bacteriostatic. 903 Mechanism of sulfonamide and trimethoprim block steps for the same metabolic pathway. 90 Foreptrin sulfamethoxazolate trimethoprim MOA inhibits purine and protein synthesis. Inhibits conversion of PABA dihydrofolic acid tetrahydrofolate THF purines DNA. 905 MOA of metronidazole by diffusion into cytoplasm of anaerobic bacteria. 906 Penicillin acts by inhibiting peptidoglycan by inhibiting transpeptidase, inhibits cell wall synthesis. 907 Angiotensin MOA block angiotensin 1-2. Angiotensin 2, potent vasoconstrictor, aldosterone and H2O retention. 908 Metformin MOA peripheral utilization of glucose. 909 Glargine tissue uptake of glucose. 910 Loop diuretics Na reabsorption. 911 MOA of furosemide, bumetanide and ethacrynic acid inhibit Na K2ClCl transporter system reabsorption. It acts on ascending loop of Henle or Na, H2O, K, Ca, Cl excretion and uric acid change in urinary pH. 912 Olanzaprazole H, K, a PACE inhibitor. 913 Cyclosporin, anti-rejection in transplant MOA. Inhibits calcineurin production and T-cell activation, or inhibits production of cytokines involved in the regulation of T-cells. 914 Combined oral contraceptive inhibits follicular growth and ovulation. 950 Nalopurinol MOA inhibit xanthine oxidase, enzyme conversion of hypoxanthine to xanthine, or inhibits conversion xanthine into uric acid. 960 MOA antipsychotic in heat stroke due to anticholinergic say and altering temp regulation center in hypothalamus. 917 MOA antipsychotic block dopamine receptor in brain. That is why it have the strongest antiemetic effect. 918 local anesthetic MOA, night channel inactivation. 919 organophosphorus MOA, inhibit acetylcholinesterase, irreversible. 920 MOA of anti-epileptic drugs, which is correct. Tiagabine inhibit neuronal uptake of GABA. 921 vigabatrin MOA, inhibit GABA transaminase, gamma, aminobutyric acid. 922 pregabalin and acamprosate MOA are GABA analog. 923 anti-epileptic block night channel. 924 topiramate, night channel blocker and GABA agonist. 925 phenytoin membrane stabilizer, night channel blocker. 902,006 lamotrigine NANCA channel blocker and inhibit glutamate, excitatory neurotransmitter in the cerebral cortex. 927 venlafaxine inhibits serotonin and adrenaline reuptake. 928 glycerin classified as alcohol. 929 benzodiazepine MOA, enhance inhibitory effect of GABA by neuronal membrane permeability to Cl ions. 93 osimvastatin MOA, B-hydroxy-B-methylglutaryl, CoA reductase HMG keto reductase inhibitor. 930 1-ibuprofen MOA, non-selective inhibitor of cyclooxygenase enzyme. 932 chloramphenicol MOA, inhibit protein synthesis, acts on 52nd subunit. It inhibits peptidase transferase step. 933 nitroglycerin MOA, preload and dilate coronary artery. It causes venous dilation, venous capacitance pool of blood, or directly relaxes vascular smooth muscle by nitric oxide. No. 934 MOA of crizotinib, anti-cancer kinase inhibitor. 93 bivaldenafil MOA, no effect on vascular smooth muscle blood flow to penis erection upon sexual arousal through inhibition of phosphodiesterase type 5. 936 MOA of dipyridamole, phosphodiesterase inhibitor type 3. 937 TV protease inhibitor, ritonavir, nelfinavir, and sakinavir. 938 stones, John's wort, serotonin reuptake inhibitor, increased serotonin, antidepressant. 930 nanoraloxifene agonist activity in bone mass and lipid, breast and endometrium, antagonist. 940 why acyclovir does not affect human cell, activated by viral thymidine kinase. 941 action of ACE on guinea pig ileum, similar as ACE esterase. 942 orfarin is active due to specific stereoisomer. MOA inhibits VIT-K-dependent clotting factors. Warfarin peak 4872. 943 MOA of nifedipine, binding to voltage-dependent receptor on vascular smooth muscle. 944 corticosteroids, phospholipase A2 inhibitor. 945 corticosteroids action in asthma is the inflammatory response and the airway hyperresponsive. 946 corticosteroids in asthma, release of mediators and mucosal edema. 947 noradrenaline acts on postganglionic sympathetic receptor on the effector organ mainly or presynaptic receptors on the nerve endings. 948 aspirin MOA, irreversible acylation of COX, thromboxane auto, synthesis platelets aggregation. 949 in MOA, inhibits synthesis of mycolic acid which is essential compound for mycobacterial cell wall. 950 MOA of propranolol, block cardiac effect of catecholamine. 951 MOA of MTX, dehydrofolate reductase inhibitor. 952 bromhexine is mucolytic, not antitussive, by depolarizing mucopolysaccharides viscosity of bronchial secretion. 9,535 carboxymethylcysteine is mucolytic by mucus gland hyperplasia. 95 phorylphenoluria MOA stimulate B cell of pancreas to release insulin, say hypoglycemia. 955 metoclopramide intestinal moiety. 956 cortisone eye drop should be stored at room temp. 957 beta-2 agonist in asthma, salmeterol, formoterol, terbutaline, and salbutamol, acts by beta-2 receptor. Thus adenyl cyclase camp and bronchodilation. 958 MOA of beta-1 agonist, adrenaline like adenol. Cyclase camp C entry to myocardial cell via inotropic effect. 959 which of the following activities does not involve parasympathetic, moving legs in running. 960 anticholinesterases, parasympathomimetic, act in narrow angle glaucoma by AQ. Humor drainage IOP. 960 1-physostigmine, short-acting anticholinesterase, used in TTT of close-angle glaucoma. Neostigmine has the same action. 962 acylthiophate iodide is cholinesterase inhibitor. Indirect-acting miotic, AQ. Humor or low-cause accommodation that used in glaucoma TTT. 963 tropicamide is a mydriatic agent short-acting, R3-4. It is not used in open-angle glaucoma. 964 Ocusert Pala 20, pilocarpine 20 micrograms H. Ocusert, Pilo 40, 40 micrograms HR, each enough for 1 week. 965 meiotic effect of pilocarpine, cholinergic agonist. Starts in 1,530 minutes, max. IOP in 24 HRs. Duration 48 HRs. Pilocarpine in open-angle glaucoma causes constriction of the pupil size and dimming vision of night. It causes brow ache. 966 action of reserpine. Meiosis. 967 carbachol is used as a replacement when resistance or intolerance to pilocarpine. 960 idosmotic agent, mannitol in acute close glaucoma. 969 dimolol and acetazolamide IOP by AQ. Humor, formation in glaucoma, but has no effect both on pupil size, not meiotic, and on the AQ. Humor outflow. 907 beta blockers used in glaucoma. Timolol, levobunolol, cartiolol, metopranolol, and bataxolol. 9,711% adrenaline, epinephrine, gives short rapid, mydriasis, but chronically IOP by AQ. Outflow. Adrenaline 1% ED produces 1-2 hours duration of action. TT of chronic angle glaucoma, but C, IN. Narrow angle glaucoma due its mydriatic action, which may precipitate acute angle glaucoma. 972 guanethidine ED 5% is used 1-2 times in eyelid. Edema and open angle glaucoma. 973 cyclopentolate is a mydriatic 1 day, and cycloplegic is used for refraction work and ophthalmoscopy. 974 cycloplegic for kids atropine drops. 970 Fivina taken with narrow angle glaucoma. Gomotropine, rapid mydriasis 2-3 HRS. 976 which not used in closed angle glaucoma. Latanoprost. 977 blockage canal of Schlemm, in the canal itself or in the aqueous veins. Glaucoma caused by this type of obstruction called acute or narrow angle glaucoma. 978 PT taking phospholine iodide should not take succinylcholine. 97 Nylphocetamide ed is not destroyed by heat in the autoclave. Lotrednol, TTT of allergic conjunctivitis. 981 advantages of timolol over pilocarpine is longer duration of action, no effect on visual acuity or accommodation, and little or no effect on pupil size. 982 belladonna is not recommended in glaucoma because it contains atropine. 983 narrow angle glaucoma is present in about 10% of glaucoma population. 984 adrenaline mechanism in glycogenolysis leads to glucose release into the circulation through its effect on beta receptors. 985 adrenaline is used with local anesthetic to prolong its action by vasoconstriction. 986 alpha methyldopamine, presynap alpha-2 inhibitory, response sympathetic output and peripheral resistance. It is alpha-2 agonist. 987 tolbutamide and fenformin, both plasma. Glucose level, and used in TTT of non-insulin dependent diabetes NIDM. 988 glucocorticoids is used in inflammation as it inhibits synthesis of prostaglandin. 989 corticotrophin secretion is stimulated by corticotrophin secretion hormone from anterior pituitary gland from the hypothalamus. 990 CAMP is not CNS mediator, but is second messenger. Vasopressin ADH MOA, tubular permeability, and water reabsorption. 992 heparin MOA, inhibit conversion of fibrinogen to fibrin and catalyzes inactivation of thrombin by antithrombin III, heparin cofactor. 993 hydralazine is arteriolar vasodilator, afterload. 994 nitroprusside and ACEs, pre and afterload. 995 antileukotriene, block arachidonate 5-lipo. Oxygenase and their synthesis. 996 prostaglandins all synthesized by arachidonic acid. 997 papaverine causes vasodilation. 998 acetylcysteine is used as inhalation. 999. Measure anti-factor XA to monitor effective noxapurin doses. 1000 aciclovir in herpes acute pain and progression frash. 1001 aspirin does not interact with MAOS. 1012 is not true about salicylamide. PT time. 1003. The use of pethidine in chronic pain is discouraged because it has a toxic metabolite. 1004. Atretinate is teratogenic. 1005 dosage of furosemide, both the renal function of the PT and the PT's current furosemide dose. 1006 which drug has most related mechanism with ampicillin, amoxicillin. 1007 counseling for HTN, check BP usually. Asymptomatic. 1008. Thiazide diuretics enhance the effect of Li. 1090 PT, who presents while on cephalosporins with fever, malaise and blistering of the skin is likely to have Stephen-John syndrome. 1010 case on MTX and leflunomide which both liver failure so shifts to adalimumab. 1011. Stimulate release of calcitonin, blood CA. 1012. Emphysema is characterized by abnormal enlargement of alveoli. 1013 women has THF and HTN and incontinence need something for HF. Carvedilol, metoprolol, nebivolol or bisoprolol if nothing of these an option, so choose one of ACEs. 1014. PT has got new drug for breast cancer, which causes leukopenia and something else. Which drug is it? Tamoxifen. 1015 PT. Who presents while on cephalosporins with fever, malaise, and blistering of the skin is likely to have Stevens-Jones syndrome. 1016 Which laxative should not be used to treat acute constipation because of its slow onset of action? Psyllium. 1017 Which of the following tinea infections is not appropriate for self-TTT and must be referred to physician? Tinea nigra. 1018. PT taking Lee carbonate advise him not to lower normal Na intake, not restrict Na in diet. Lee is CI with diuretics. 1019 All of the following are important counseling tips for the use of nicotine replacement therapies, except patches should be removed after 8 hours of use if the person experiences insomnia. 1020. PT with mature onset diabetes can be treated with tolbutamide and diet. 1021. PT on probenecid therapy advise him not to take aspirin. 1022 Which of the following would be inappropriate counseling for a female purchasing intravaginal miconazole? Say can include burning or irritation. 1023. PT with digoxin should not take laxative to prevent hypokalemia, which digitalis toxicity. 1024 When advising PT on the correct use of Edwidge, one of the following statements is incorrect. Hold the tip of the dropper against the lower lid. 1025. If patients have to use benzoyl peroxide CR during the day, advise them to use sunscreen and avoid unnecessary sun exposure. 1000 and 2006 Counseling for benzoyl peroxide for acne. Itching and irritation is air repeated use. So, use with erythrogel in the morning because this causes least irritation. Skin peeling may occur. Avoid contact with hair. Start with 5% and apply every day. Stain on colored clothes and may stain yellow. 1027. PT on propranolol and metoprolol has nightmares. Shift to more hydrophilic beta blockers like atenolol or nadolol. 1028. Tell PT treated with indapamide that the drug may cause K loss. Thus K supplement, orange juice or banana, is required. 1000 and 2009. PT on kanamycin antibiotic Fasofor cannot hear due to damage of 8th cranial nerve and effect on auditory nerve function. 1030. PT infected with infectious mononucleosis experience rash after ampicillin therapy. 1031. Woman taking combined pills for 21 days and 5 days rest, but the bleeding does not occur. You advise her to stop the pills as she may be pregnant. 1032. HF with lignocaine causes in lignocaine level due to hepatic blood flow, thus clearance, so dose is required to. 1033. PT taking phenazopyridine, azodie used as urinary tract analgesic, should be advised that urine color would be changed. 1034. PT on sucralfate, cytoprotective on peptic ulcer disease, should be advised not to take the drug with food or antacid. 1035. Combined oral contraceptive advises when prescribing choose correct. Smoking risk of thromboembolic events. 1036. PT has depression and taking warfarin, thyroxine, and antidepressant, which will change the thyroid function. Both lithium and amiodarone. 1037. PT taking phenytoin experienced ataxia. What to do? Phenytoin dose. 1038. PT receiving phenytoin may develop morbilliform rash, which is measles-like. 1039. PT taking loperamide advise him not take it in infectious diarrhea as it causes stasis of M. 1040. Glyceryl trinitrate. Advise the PT to take it in sitting. Position to avoid first hypotension effect. 1041. PT on carbidopa and levodopa complain of dark wine urine discoloration of levodopa metabolite. 1040 twerks. Verapamil, captopril, propranolol, and slow K. You expect that the PT has bradycardia. 1043. PT with fentanyl patch with renal impairment. The dose should be reduced to 12. 1044. Emergency case PT with hypotension. Shock first choice is dopamine because it has the inotropic effect on heart, beta agonist action. Release knee from its store, BP. Activate dopamine receptors in kidney to renal blood flow. Infusion is interrupted to tachycardia as dopamine has very short T12. 1045. PT taking lisinopril have light sputum. Emergency case PT with hypotension. Shock first choice is dopamine because it has the inotropic effect on heart, beta agonist action. Release knee from its store, BP. Activate dopamine receptors in kidney to renal blood flow. Infusion is interrupted to tachycardia as dopamine has very short T12. 1045. PT taking lisinopril have light sputum. Cough. Guafenicin. 1046. PT with HTN non-productive cough, taking fulcodine. Stop what? Ramipril. 1047. PT has HTN, HF, unilateral renal artery stenosis, should take captopril. 1048. Most appropriate for bilateral artery stenosis in PT, taking verapamil, methyl-dopa. 1049. PT makes coronary intervention and need to take antiplatelet and has hyperlipidemia, which is best 1. Silostazole. 1050. PT has Ra and acute lymphoid leukemia and take mercaptopurine, which should be avoided in RE therapy. Sulfasalazine. 1051. PT allergic to tramadol, what should we give in Ra? Cocodamol, codeine paracetamol. 1052. Child 4 years to be hospitalized when swallowed 10 mg of 300 milligrams quinine. 1053. Child 10-12 years old got an adverse effect related to asthma. Long-term oral corticosteroids. 1054. Case study on acamprosate, PT with alcohol dependence, hyperlipidemia, insomnia. Which drug least cause insomnia? Say, acamprosate. 1055. Case on digoxin, HF, perindopril, N and V, digoxin. Avoid in sulfa allergy celecoxib. 1056. Case statin aciflu, loratadine. 1057. PT has sore throat and allergic to penicillin. Which drug should be given? Erythromycin. 1058. PT takes lisinopril, has fever, rhinorrhea, and sore throat. Take paracetamol and diphenhydramine. 1059. Which is incorrect in diabetic foot? Most common. M. MRSA. It is caused by staph aureus and strep. TTT augmentin. 1060. PT takes digoxin and N and V suddenly occur. He took verapamil and then toxicity occur. 1061. PT has UTI, take ciprofloxacin and no improvement. What is the cause? Antacid. 1062. If PT take low Na intake, change to potassium chloride. 1063. PT has high alanine transaminase alt, liver enzyme, cause women use rifampicin, warfarin rifampicin. 1064. Women being treated for TB. Which of the following is likely to the hepatic metabolism of drugs? Rifampicin, 1,065 women taking rifampicin, what would you not? Counsel her. Take Vit B6 to neuropathy. 1,066. The most appropriate counseling for women taking oral contraceptive and doxycycline. Use a second method of contraception while taking doxycycline. 1,067. PT with asthma and HTN shift aspirin to clopidogrel. 1,068. PT taking haloperidol and has galactorrhea. What was the cause? Hyperprolactinemia. 1,069. PT with diabetes advice not to remove corns and callus. 1,070. PT with RA and allergy to tramadol taking celecoxib but still have mild pain. Fish oil or oxycodone? The right answer. If said all can be used except choose fish oil. 1,071. Asthmatic PT and CHF and angina. Aspirin shift to clopidogrel. Analgesic after dental extraction is paracetamol. Not common say of aspirin. Urticaria. Docusate na. Chronic flatulence. Stop 24 HRs. Before diuretics due to hypotension. ICE. 1,072. Omeprazole use OTC in case breastfeeding. Mother tried antacid and ranitidine with no benefit. 1,073. Digoxin. ICE. Celecoxib. Spironolactone. Loop. Diuretic. Symptoms of N and V due to digoxin toxicity. Which drug may cause RF after add to celecoxib? ICE. Gout attack may be due to loop diuretic. 1,074. A PT on MTX and take leflunomide. Hydroxychloroquine, which may impair hepatic function. Leflunomide. No improvement in Ra, shift to XMAB, adalimumab, rituximab. Visual impairment. Hydroxychloroquine. 1,075. PT on carbamazepine and phenytoin. Physician wants to add amitriptyline. ECG change and neurological status change. 1,076. PT is scheduled for heart valve replacement. The nurse gives him anaphylactic antibiotic which caused flushing, erythema, and pruritus, usually affecting the upper body, neck and face more than the lower body. The antibiotic is most probably vancomycin, red man syndrome due to rapid infusion. 1,077. What should you do if PT came to ask you for phosphate enema for colonoscopy scheduled next week? PT is on lisinopril and furosemide. Call the doctor. 1,078. Buprenorphine counseling advice. Avoid direct heat on patch. 1,079. A natural drug use in Paget's disease. Calcitonin, TTT, bisphosphonate and calcitonin. 1,080. Paget's disease can be treated by all except pyridoxine. 1,081. Ginkgo biloba cerebral blood flow, TTT, memory. Cognition. 1,082. Ginkgo biloba, not used in abdominal spasm. 1,083. Boric acid is not used in the topical skin. Preparation for infants because it causes boiled lobster rash. 1,084. Less sedating antihistamine, cetirizine. 1,080. Perfavurocochuric, excretion of uric acid in urine, like probenecid, losartan, and sulfonpyrazone, but not allopurinol. 1,086. Diuretic effect of ethanol due to ADH in posterior gland. 1,087. Tablets cannot be crashed. Alendronate and omeprazole. 1,080. Deoxyperheptadine and apixaban can be crashed. Apixaban can be mixed water and juice. 1,089. Calamine lotion xenoferric oxide Fe2,3. 1,090. When holding chemotherapeutic drug, which is wrong. Crushing of tablet should only be done by pharmacist. 1,091. In clindamycin topical preparation, mix with water and then add alcohol and propylene glycol. 1092 Preparation of potassium iodide and iodine. Water, peppermint oil and glycerin. Mix key first with water, then iodine, then peppermint oil and glycerin. 1092 Preparation of potassium iodide and iodine. Water, peppermint oil and glycerin. Mix key first with water, then iodine, then peppermint oil and glycerin. 1093. If salicylic acid is added to chloroform, then nitric acid is added. Salicylic acid will be present mainly in the lower layer. 1094. Injection of large amount of purified H2O in RBCS, swelling and burst. 1095 Benzodiazepines drug, lignin-modifying enzyme. LME, to overcome the problem add cimetidine, LME inhibitor. 1096. If we mix NACA3 to 5% glucose, nothing will happen. 1097 When a sol of soda lime is exposed to air, CO2 will react with it, forming CACA3 and PT occurs. 1098 When hexylresorcinol is exposed to air, it is oxidized. 1099. Sulfone formation in vivo due to oxidation of mercaptopurine. 1100. Ethylene glycol oxidation gives oxalic acid. 1101 chloroform stored in airtight light resistance container not above 30 to prevent oxidase to phosgene gas HCl. 1102 Propranolol, oxyphenbuzone NSAIDs. Nortriptyline and reserpine exhibit hepatic first pass effect, but aspirin and phenytoin are not. 1103 When drug has first pass effect in the liver, that means it has less systemic effect. 1104. Selective alpha blockers no tachycardia. 1105 Alpha blockers and ACEs cause hypotension in first dose. 1106. Intermittent IV therapy, piggyback, is used to avoid anticipated stability or compatibility problems, the potential of thrombophlebitis, better diffusion of some drugs into tissues. 1107 Greatest drug conc. Gradient between blood and tissue will occur when drug is administered by IV bolus. 1000. 108 Most rapid effect can be achieved by which route of administration? 1109. Suspension is not suitable to be administered for 1110. Which of these statements does not apply to phenol, not soluble in HCl? 1111. The most common cause of systolic dysfunction in CHF are ischemic heart disease and HTN. 1112. Signs of left-sided HF: shortness of breath, paroxysmal nocturnal dyspnea. 1113. The cause of death in acute PCM overdose is due to accumulation of toxic metabolites resulting in hepatic necrosis. 1114. Sumatriptan antagonizes the action of serotonin. 1115. Peptic ulcers associated with excessive acid. Secretion. 1160 in diabetic retinopathy is characterized by microaneurysms and vitreous hemorrhage. 1107. 1160 in diabetic retinopathy is characterized by microaneurysms and vitreous hemorrhage. 1117. The structures which prevent backflow of the blood to the ventricles of the heart are the aortic and pulmonary valves. 1118. If an infection of throat has spread to the eustachian tube, to the middle ear the infection is mostly then spread. 1119. In myocardial ischemia, beta blockers act by agents with high intrinsic sympathomimetic activity, the risk of reinfarction. 1120. Coronary blood flow is not determinant of myocardial O2 demand. 1121. Which of the following is not among those actions of propranolol which are due to beta-1 adrenoreceptor blockade? Reduced peripheral blood flow. 1122. Digoxin is bound to Na-Ka pace in the heart. 1123. Cardiac glycoside the force of contraction by inhibiting Na-K pump, causing second rise in Ca accumulation. 1124. Simvastatin LDL and Tg. 1125. All of the following are features of simple competitive antagonism except conc of antagonist shifts the agonist log conc. Effect curve to the left. 1126. Colchicine can relieve the symptoms of an acute attack of gout because it inhibits neutrophil infiltration. 1127. Which, if the following is not an anti-inflammatory? MOA of glucocorticoids. No. Of circulating neutrophils. 1128. Trimiprazine, piperidine, antihistamine. 1129. Contamination of drug occur in all except trimiprazine, piperidine, antihistamine. 1129. Contamination of drug occur in all except exclusion. Inclusion without except. 1130. A drug is excreted 90% unchanged in urine and chloramphenicol is 5% excreted unchanged with urine. Adjusting the dose in renal impairment is required in first drug only. One 131. Any drug excreted 30% unchanged, no need to adjust dose in renal impairment. 1132. Polymerase chain reaction PCR, not sure about the exact name, function, amplification of DNA chain. 1133. Drugs safe in IV bolus salbutamol. 1134. Antifungal not applied topically. Griseofulvin. 1135. Poloxamer, non-ionic block copolymer. 1136. Wrong for suppository. Melt below 30. 1137. What is the WT of sup? Rectal 2 grams and vaginal 5 grams. 1000. 138. Sup. Made with carbowax and glycerinated gelatin as base, should be dipped in water before insertion. 1,139 milligrams. Stearate uses lubricant and osmotic laxative. 1,140 chelating agent, mg metabisulfite. 1,141 polyethylene glycol, used as base for oint. H2. It is osmotic laxative. 1,140 tuna metabisulfite is antioxidant or reducing agent. 1,143, which is not an osmotic laxative or SA. No. Metabisulfite. 1,144 chelate must always contain multivalent metal. 1,145. Editat D sodium. Chelating agent. 1,146, which Ca is not taken orally. KCl2. It is not antacid. 1,147. A good antacid should raise pH from normal value of 12 to pH of 3.5. 1,148. At which pH protein is most likely to precipitate. At isoelectric point. 1,149. If pKa occur at half neutralization point. 1,150. If pH alkaline, excretions of acid salicylic acid, morphine, dopamine, and codeine. 1,151. Acidification of urine, excretion of alkaline drugs. Amphetamine. Due to ionization, so absorption. 1,150. Twoic-based drug is easily excreted by NH4 salt, NH4, Cl acidifying agent. 1,153. Ion trapping, alkalinization of urine, excretion of weak acid drug. 1,154. Drug for UTI by urinary alkalization. Nitrofurantoin. 1,155. PFs affects absorption rate. 1,156. Salicylic acid is weak acid. If pH GT, pKa, what will happen? Ionization Pc, solubility and absorption will. 1,157. pKa of weakly acidic drug equals to pH of the medium. Then, according to Henderson-Hasselbalch EQ, 50% ionized and 50% unionized, pK acid pH media. 1,150. Atoral drug with weak pH will be more absorbed from stomach. 1,159. Drug with pKa 6.2. This drug will be 50% ionized in small intestine. 1,160. For XR tab, drug releasing depends on pH. 1,161. Drug absorption is mainly passive absorption. 2. Improve passive absorption of drug. PC. 1,160. Twin neutral compounds absorbed from lipid biological membrane depends on PC. 1,163. Hydrophilic depend on osmolarity. Hydrophobic depend on PC. 1,164. Time of disintegration of most uncoated tab, 30 min. 1,165. EC tab. Bioavailability depends on disintegration. 1,166. Immediate release tab limiting rate, dissolution, 1,167 dissolution rate affect absorption of oral drug. 1,168 dissolution depends on M, WT, pH, conc, and particle size. 1,169. To dissolution of drug makes it in polar salt form. 1,170 which not affect oral absorption of drug. T12 and M, WT. 1,171. Least affect oral CNR absorption is T12. 1,172 which is not factor in the absorption of drug. Kidney metabolism of drug. 1,173. For drug to be released from its dosage form, it needs to be different pH. 1,174. To absorption of oral drug makes it enteric coated to salt form lipophilicity solubility. Rhizofulvin is prepared in microcrystalline form. To enhance its stability and absorption. 1,176. Ferrous salts are the form of iron which are absorbed, while ferric salts and elemental iron are not absorbed well. 1,177 absorption of drug. 176. Ferrous salts are the form of iron which are absorbed, while ferric salts and elemental iron are not absorbed well. 1,000. 177 absorption of drug after oral depends on lipid, water solubility or lipophilicity. One 177 absorption of drug after oral depends on lipid, water solubility or lipophilicity. 1,178. S or IM is best absorption rate because lipid solubility. 1,179. Thiopentyl sodium is ultra-short-acting general anesthetic due to its high lipophilicity. 1,180 highest absorption of drug occurs in duodenum. 1,181. The main absorption site after oral administration. Small intestine. 1,182 greatest absorption. Upper intestine duodenum. Jejunum ileum. 1,183. Ileum is the max. Side for vitamins absorption. 1,184 what not affect the dose of transdermal patch. Absorption depends only on drug nature. 1,185 vancomycin is formulated in liquid form with flavor. Because not absorbed in TTT of pseudomembranous colitis. 1,186 we occlusive plaster or dressing with topical corticosteroid to enhance dermal penetration of the steroid. 1,187. Tetracycline, bacteriostatic, gives different absorption and dissolution patterns because it is amphoteric, forms salt with acid or base, and capable of forming internal salt. 1,188 why weak acid and weak base absorb from small intestine. Large surface area. 1,189 buffer sol is used to resist change in pH. 1,190 non-ionized drugs are more lipid soluble than ionized. 1,191 pKa log of ionization constant indicates the relative strength of acid or base. 1,190 12H buffer is best for pKa4. Lactic acid. 1,193. To prepare a buffer system of pH 4 use lactic acid, pKa 3.86, pH 4.7, 1194 wrong about alkaloids, pKa less than 7, 1195 phosphate buffer is used for nasal preparation. 1196 allopurinol does not bind to plasma protein. It is not given with T. 1197. Tolbutamide displaces coumarin from plasma protein. 1198. Sulfamethoxypyridine is long-acting as it's highly bound to plasma protein. 1199. How to make antipsychotic make muscle depot for long duration. Bind the drug to long-chain fatty acid. 1200. Lignocaine has long duration because it is amide. 1201 VD is the same, PT with 50% reduced renal function. What is the time to reach steady state? 45 T12 12 HRs. 1200 and 1202 phenylbutazone has the longest T12 75 100 HRs. It is also displacing other drugs from plasma protein. 1203 chlorpromazine has long T12 when given instant message. It has better bioavailability. 1204 nitrazepam has T12 25 35 8. Produce long day. Time sedation, which should be avoided in elderly to avoid falls and fractures due to accumulation of nitrazepam sedative effect. 1205 chlorthalidone is the longest acting diuretic of T12. 4060 HRs. 1206. Steady state is achieved at 4-5 T12. 1207. T12. Time required for conc of drug 2 by 1/2. Or time of drug to reach 50% of its conc in blood, or when drug achieve 59% of its pharmacological effect. 1208. The radioactivity of compound to decay by 50% is called T12. 1209. Doubling the drug 1209. Doubling the drug conc in the blood that follow first. Order kinetic will not affected by T12. 1210. Drug following first order kinetics if conc is doubled. Bioavailability is too much. 1211. If T12 27 HRs, which is true, accumulated if used every 24 HRs. 1212. If T12 to half and dose doubled, what will happen? Nothing will happen to the T12. 1213. A specific drug with first-order biological T12 of 4HR. This T12 value will be independent on initial conc. 1214. Linear kinetic. Rate of elimination is proportional to drug conc. 1250. In drugs that show non-linear pharmacokinetics. T12 as the administered dose. 1216. In zero order, non-linear. T12 is dose-dependent and elimination rate is drug plasma conc. Independent, while in first order, linear. T12 is dose. Independent and elimination rate is drug plasma conc. dependent. (1,217). Fixed-dose drug eliminated by first-order kinetic, administered at regular interval, the time required to achieve steady plasma conc. Depends on elimination T12 of drug, 1,218 CS or conc. Of chronic administration depends on elimination T12, 1,219 after chronic oral dose plateau is based on elimination T12, 1,220. Time needed to reach steady state depends on T12, 1,221 measurement of drug accumulation in plasma. After chronic use, T12, 1,202 chronic oral therapy taken every day or infusion, CP depends on T12, 1,223. Shelf life T90, 10% of the radioactive material to decay. 1,224 which most true regarding linear pharmacokinetics. It is dose independent. 1,225. Initial plasma conc after IV bolus or single dose is affected by dose and VD. 1,226. Initial with low dose, ACs and thiazides. 1,227. LD depends on plasma conc and VD. To calculate LD1 most first determine VD. 1,228. LD is not variable between species. 1,229. Purpose of giving LD. If therapeutic effect level is needed quickly, and the drug has long T12. 1,230 need LD, phenytoin, digoxin. 1,231. LD of which drug should be in CH. Hydrochlorothiazide. 1,230 tuned LD for parenteral route. Digoxin, or digoxin, in HF and arrhythmia, or phenytoin in seizures. 1,233 max. Buffer capacity with pH 4, pKa acid 4. Buffer is used in IV. 1,234. Low bioavailability means VD is low in tissue and high in plasma. 1,235 VD high means accumulation in tissue. 1,236 drug has poor oral bioavailability, which is not reason. Metabolism by kidney. 1,236 drug has poor oral bioavailability, which is not reason. Metabolism by kidney.